To a story that is likely to put more pain on your pay slip. The Social Health Insurance Bill is set to be tabled in Parliament tomorrow, following the conclusion of public participation. The bill is amongst a raft of pieces of legislation that the executive hopes will be enacted ahead of the launch of the Universal Healthcare Program next month. The Social Health Insurance Bill, or SHIB, establishes the Social Health Insurance Fund that will take over the National Hospital Insurance Fund, that is NHIF, and its implementation could see Kenyans pay more in taxes to finance the provision of health services envisioned under the Act. So the bill's tabling comes as the President launched the distribution of health kits across the country. Brenda Wanga has more.
The first phase of the government's plan to provide universal health coverage across the country kicks off with the disbursement of 100,000 health kits to be used by community health promoters to provide basic health services in homes across the country. This activity precedes the formal launch of the Universal Health Coverage Program during this year's Madaraka Day celebrations in Kericho. But before that happens, the President is keen to have the laws that will guide its implementation in place.
I request you, members, to work with us to expedite the legislations that we have put in place so that we can make sure that this program is anchored in law.
Both houses of Parliament pledging to support the passage of the bills.
Tuko na malizia mambo ya public hearings na kufikia kesho we shall table the bills pamoja na ile digital health bill ambaye itahakikisha kwamba yale mnafanya kule mashinani agency ambayo itahusika naye itaweza kuyaweka katika health information system yetu.
Ya pili tuko na primary healthcare bill ambayo pia tunashughulikia na tunajua ndani ya wiki moja tutakuwa tumeweza kupitisha kama bunge la Seneti.
The laws that have been proposed, the 4 bills that are proposed that are before Parliament today, which have had very comprehensive consultation, and we want to confirm here today we are consulted as Council of Governors and we have given our input, are going to make sure that we have a uniformity in the whole of Kenya, where there is a CHV from Tharaka-Nithi, Turkana, Mombasa. They are going to operate under the same standards.
The Social Health Insurance Bill seeks to establish the Social Health Insurance Fund that will be used for preventive and promotive and primary care services at community, dispensary and health center levels, and build a chronic illness and emergency fund that provides for chronic illnesses. To actualize this, the government will be seeking to deduct 2.75% of the gross pay of her taxpayers to raise the money needed. Those eligible to contribute are every household, non-Kenyan residents residing in Kenya for a period exceeding 1 year, the national government, the county government, and any other employer. The government's plan to provide these health services will also be depending on accurate data of citizens eligible to benefit. This data collection exercise will also be tied to the provision of basic health care by the community health promoters.
We are also starting the journey to register every household in Kenya so that we can have the information on the health requirements, on the health condition, on the prevalence of whatever diseases in every part of Kenya.
The CHPs undertaking the exercise are said to be provided with a stipend from both the national and county governments, the President falling short of stating exactly how much money each of the 100,000 CHPs will get. There have been murmurs of discontent from county governments over this arrangement, with the lack of uniformity in payment of the stipends and the fears that the national government may not honor its pledge, leaving counties with extra bills that are unbudgeted for. Brenda Wanga, Citizen TV, Nairobi.
Well,